Every outbreak tells two stories. One is counted in numbers and in cases. The other in silence, in fear, and in the choices people make every day. To respond effectively, we must understand both. Treating the two is true impact. Across Nigeria, MPOX continues to pose a public health challenge, but the virus itself is only a part of the story. Behind every reported case are beliefs, fears, decisions, and systems that shape what people do next. That is why the Slow Rural Health Initiative, in partnership with the UK Public Health Rapid Support Team and the London School of Hygiene and Tropical Medicine, led a community-based research project to better understand these unseen factors, how communities perceive MPOX, and why many in Ogun State delay or avoid seeking care. Using a community-centered approach, SRHIN worked from within the communities it serves. 17 citizen ethnographers, community members themselves, were trained alongside 4 research assistants to document lived experiences, observed behaviors, and capture real everyday narratives. The work was supported by technical experts from UK PHRST and LSHTM, ensuring methodological rigor while maintaining strong community ownership. While in-depth interviews were conducted with healthcare workers, traditional leaders, and key stakeholders. What emerged was a complex and deeply human picture. Knowledge of MPOX was often limited and frequently shaped by misinformation. In some communities, the disease was linked to witchcraft or environmental causes rather than understood as a viral infection. Symptoms were often normalized or dismissed as mild, leading many to delay seeking formal health care. Instead, people turned to self-medication, traditional remedies, or spiritual interventions. But one of the most powerful barriers was not just knowledge, it was stigma. Fear of judgment and social isolation led many individuals to hide symptoms entirely, silently increasing the risk of transmission. Even when individuals chose to seek care, systemic challenges stood in the way. The cost of treatment, limited healthcare capacity, and negative experiences with healthcare providers all contributed to reduced trust in the system. Together, these factors created a cycle where misinformation, stigma, and structural barriers reinforced each other, delaying timely intervention. In response, SRHIN alongside its partners moved beyond data collection to active engagement. Findings were shared through multi-stakeholder platforms involving government health authorities, traditional leaders, community leaders, and the citizen ethnographers themselves. These were not one-way presentations, but collaborative spaces where participants validated findings, challenged assumptions, and co-developed practical solutions. The key recommendations developed focused on, number 1, strengthening risk communication with culturally relevant messaging, addressing stigma at the community level, improving trust and experiences within healthcare systems, and expanding community-driven surveillance and engagement strategies. At the heart of these solutions was a simple but critical insight. Communities are not just beneficiaries of public health interventions, they are essential partners in shaping them. Effective outbreak response goes beyond medicine. It requires understanding how people think, what they believe, and the realities they navigate every day. Led by SRHIN with support from UK PHRST and LSHTM, this project helped shape a more responsive, inclusive approach to public health in Ogun State, across Nigeria, and in communities facing similar challenges worldwide. Because ultimately, the success of any response depends not only on systems, but on trust.